The benefit of making contributions to the foundation now as it exists has always existed since the beginning, and those who made contributions a long time ago, your investment is secure. It continues to help the beneficiaries of the foundation, as will your contributions of yesterday, last month, or next year, or into the future. It simply exists for the benefit of the patients and the healthcare in Venango County.
The Oil City Hospital for a number of years received numerous contributions back through the years starting in the early 1900s. That continued, and most of those funds that were received went into the hospital general fund, or they were restricted by the donor. And back in 1981, 82, we actually wanted to start a significant capital campaign for some renovations and also a new ICU for the Oil City Hospital. And so we actually generated or started a 501c3 foundation. We had a goal of $1 million, and I believe we hit $1.6 million through the community. From then on, all contributions and donations towards that hospital were directed to the foundation.
Franklin Hospital Foundation, at the time that we did all the creation of it, and the reason for the creation to provide funds for this was because at that time, a lot of our area hospitals were not doing the foresight that we were doing by bringing in specialists and bringing in modern equipment and all that in the rural areas. Without that funding source and revenue source that the foundation was providing, we probably would not have been able to accomplish that.
It became evident through the healthcare industry that the two hospitals 10 miles apart needed to have closer relationships. Back in 1990-91, the boards were able to get together and identify a purpose and a direction to bring those two organizations together. Always with the intent of having a new hospital that was somewhat equidistant between the two communities.
The reason the Oil City Foundation and the Franklin Regional Hospital Foundation merged, the investments in the individual entities were fragmented, and they needed to make more sense and to be consolidated into an understandable thing where donors and that could have confidence in the true consolidation of the two without fragmentation. The public confidence in that has provided for people in their estate plans and that to be supportive, and it's encouraging to somebody who was there at the very beginning to see how it's matured and how the professional investment and management is now it's a real entity that as time goes on, it's going to be more and more important.
Rural medicine is going to be very difficult to continue. A number of hospitals have gone out of business just because they don't have the volume or the service area or the foundation or the reimbursements there to make it viable. And so I think, in hindsight, looking forward, this was the right decision. It's in good hands with the board and the foundation, and I'm very optimistic about its future.
We have to be good stewards of the legacy. We have to remember those that came before us that really had the vision to have a foundation so that they could, in fact, help others, maybe make a hospital that's better than other rural communities. We are providing training, we're providing programs for staff, we are providing equipment that they may otherwise not have here. We provide patient uncompensated care for patients. We have a walking trail around the hospital that the community can use. There's a exercise equipment outside, and that's for patients as well as staff, as well as visitors that come in. It's all of those kinds of things that I'm not even sure that even earlier benefactors believed that we would be able to do these kinds of things that go outside of the actual hospital facility, but has actually reached out into the community and provide services for them. So if we've done this now, just think of what can happen in the future.